السلام عليكم ورحمة الله وبركاته. بسم الله والحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه ومن والاه. I'd like to welcome everyone to the seventh episode of Ruh Revival, the McMaster MSA led podcast initiative. I hope everyone had a good exam season. By the time this episode airs, we're going to be enjoying our summer vacation for those of us who have vacation. But whatever your plans are, we welcome you to this episode. We're going to be talking about a topic that is very important, somewhat contentious in Muslim circles, but it's something that's on the minds of many, many Muslim students. And I think the lecture that you gave at McMaster, I think it's the most viewed lecture that we have on or the most viewed video that we have on our YouTube channel. So it's clearly a very important topic. The topic for today is therapy or tawakkul, the Muslim's journey with mental health. So today's episode explores the contentious aspects and valid concerns that exist around mental health and therapy. Living here and trying to be part of an emotionally aware and sensitive generation, Muslims have also been exposed to highly studied and increasingly popular mental health research. Today, we very often discuss mental health issues like depressive disorders and anxiety disorders, and the myriad of treatments from medication to exercise to therapy. But should we as Muslims be approaching these issues in the same way? What does Western therapy miss? And to what extent should we just try to improve ourselves and rely on Allah instead? Now, to help us answer these questions, I'm going to introduce our beloved Sheikh Ayman Taher. Jazakumullah khair, Sheikh. Hayakumullah. Sheikh Ayman was born in Palestine and raised in the neighboring country of Jordan. He earned a degree in counseling psychology from Alberta. Then he became a registered psychotherapist with the College of Registered Psychotherapists of Ontario, the CRPO. He studied the Islamic sciences at the Islamic Open University in Qatar, and he is also a chaplain at the Hospital for Sick Children in Toronto and a chaplain for the Hamilton Police Service. Assalamu alaikum, hayakumullah. Very happy to be with you today. I think we're going to be starting very basic. So, what does mental health mean? And why do you think it has become, stigmatized both in the general and more specifically in the Muslim community?
Now, first of all, I wanted to start by thanking Allah Azza the Mighty for giving us the chance to be able to do something like this. Alhamdulillah, this is for me an excellent opportunity to serve the cause of the Muslim Ummah. And I want to thank you guys. Do not underestimate the work you are doing. Alhamdulillah, despite of your busy schedule, despite of the academic life, which is a roller coaster, you're still managing to be engaged into activities that are for benefit for the community. Alhamdulillah, that's a blessing from Allah. So thank you so much for doing that. And yes, indeed, inshallah, I'm happy to hear that there is an increased awareness from the community about this important topic. And today, inshallah, what we will be sharing is my practical experience with this, not the academia, because the academia, I'm sure that many of the people on the campus who are specialized in psychology or related issues have more depth into the textbooks, the statistics, the numbers, the research that has been done. What I'm about to share here is my practical experience, which has been almost 27 years in this field, starting my work in the Hospital for Sick Children as a spiritual counselor, earned my degree, and then become a member of the College of Psychotherapy of Ontario. And alhamdulillah, I noticed that this practical experience is what would be of a most relevance to be shared with the rest of the community, and especially and more specifically the population of campuses, students who are living in campuses and living in the academic life. Now, going back to your question, as we're breaking down the topic, what does mental health mean? Now, according to the World Health Organization, mental health refers to a state of well-being, which every individual realizes his or her own potentials and have the ability to be resilient in different challenging circumstances, have the ability to cope with the stressors that are exposed to them in life, and can be also a productive individual in work environment. And at the same time, they're also socially connected with others around them, meaning to say their family members, their friends, their community, the society in which they belong to. So looking at that, you could see that mental health refers to a state of well-being whereby you are a productive individual, where you max your potentials as a human being, as a productive human being, with people around you. And when we contrast that with mental illness, we can look at the continuum. The peak of it, or the positive, is mental health, and the negative is the mental sickness. And along the continuum, we move to being in the peak, most positive, most productive, most healthy mentally, or being down. Now, along the two lines, being with the two extremes, there are certain factors that dictates of what is our mental health. Now, of course, at the beginning, we look into the genetical makeup. We inherit things from our parents, and these genes we carry do influence the way we interact with others around us. And of course, these genes would not be active, or would be, their activity would be determined with the environment. And there are also the environment factor, environmental factors, whereby we are influenced with what happens in the family, with happy, sad occasions. We're influenced with what happened at work, challenging or difficult environment. We're also impacted with what happens in the community, and in broader context, the society, and generally speaking, what happens on earth. Nowadays, I don't think we can hide the fact that the community in general, and the global population in general, is very much affected with what's happening in Gaza. They're very concerned. They're engaged with the news, and that impacts the status of the mental health. So you could see that it's a very dynamic issue, that it would be defined and determined and evaluated based on the interaction of the individual with the environment around him or her.
Interesting. Yeah. Why do you think? Like, I think we just want to go back to the point of why it's been stigmatized. I think generally it's, I think that stigma has declined greatly in the, I guess, the global West, but, or so, not global, the general, like, Western population. But when it comes to Muslims, I think we as Muslims are lagging behind when it comes to the idea of stigma, the stigma that is associated with it.
Well, I mean, this is not a Muslim issue, by the way.
Hmm.
Stigma around mental health is not, related solely to the Muslim community. It's a broader issue that the general population is dealing with. And we could probably be saying that it's less affecting right now in Western societies, and even like Western society, Eastern societies, because of the global village like we're living in, where whatever happens in the West is echoed in the East. But in general, there's a lot of work has been done from the mental health sector to educate the public. And I remember myself when I first took my first aid mental health first aid course or training. At that time, it was something unique. It was like the was offered to the community activist as a mean of helping to spread the word, engage the popular in the community, and raise awareness. Right now, it is becoming a general topic. Everybody's aware of mental health. The stigma associated around this issue is less severe than it was in the past, but it's still there. Now, as to why there are, there's a stigma, it's obviously coming to the perceptions that build around people who might be influenced with mental health. The perception comes around mental health is that people are crazy. They're, that they're not in a stable living, healthy condition, and that means we need to be careful dealing with them, or we need to be careful as these you know these issues that people are having in their life could be inheritary to the generations to come. So when it comes to social interaction, when it comes to marriage, when it comes to interacting with people with mental health issues, people become so concerned. I just need to avoid that part. Now, um, whether this is true or not, that's completely different. But these are some of the perceptions that are built into people's mind. And normally what I try to to say to people in this context is that, do we look down, or do we think twice, or do we think in a different way with people who have physical illness? Let's say someone is diabetes, or someone with blood pressure, or a problem, or someone with with heart problems. We don't look at them as like just be careful. No, we look at them as individuals who are being affected in their life, and we need to be empathic with them and supportive. And so they're able to move on in their life. And by the same token, this is what I stress on into educating the community. uh, you know the stigma needs to be faded. The way we interact and we see and look at the people with mental health needs to change, because if we were to be more empathic with them and more supportive to them, that means we're contributing to the well-being of the individuals with mental health issues. So it's not only taking off this stigma. It's not only about fading the perception. It's about also contributing into the improvement of the mental health state or well-being of individuals with mental health.
Mhm.
Yeah.
Jazakumullah khair.
Okay.
I think to help with the destigmatization, maybe I know there's a lot of research being done with regards to identifying mental illnesses or classifying them.
Mhm.
Is there any research or evidences that you know of pertaining specifically to Muslim families when it comes to mental illness? Mental illness, or even Muslim youth?
Yeah, I was trying to find more specific, numbers or statistics built around that issue. But I come across a study published in the Muslim Mental Health Journal, in which they reached the conclusion that whatever issues we're dealing with as a community are not so different from what is happening in the general society. And from that perspective, I could say that according to Stats Canada in 2020, one out of five individuals in Canada were affected with mental health issues, or were having mental health issues. That number have increased in 2021, the year after, and it's still remaining the same in 2023. So one out of four individuals do have mental health issues. Now we were when we talk about having mental health issues, we're not necessarily talking about mental illnesses. We're not talking about issues that cripple individuals from being able to live normal life and be productive, but we're talking about states that prevents people from fully being able to unleash all their potentials and live an optimum life with themselves and others around them. Because if you were to look into what are the factors that of being healthy mentally or mental health, you're talking about resilience. Because being in the optimum side of mental health, you're a resilient people, and resilience is what keeps you going in difficult, challenging circumstances. And you probably have heard this a lot from people who are engaged into the issues of Gaza. They say, like, we're so embarrassed. What is it that keeps the people of Gaza so resilient? What keeps them going? What is it that behind their ability to stand up firm in the difficult situation and circumstances they're living in? When we go back in time and study the history and figure out what was behind the Sahaba, the companions who have demonstrated resilience in most difficult and challenging circumstances they were faced with, as being believers to their own prophets, not only the Prophet Muhammad SAW and the Sahaba. We're talking even, generally speaking, to all the believers who were with the prophets of God. قتل أصحاب الأخدود النار ذات الوقود هم عليها شهود وهم على ما يفعلون بالمؤمنين وهم على ما يفعلون بالمؤمنين شهود. So there's a lot of stories that talks about resilience. What is it? What behind? So resilience is what defines being mentally healthy. I'm just going quickly over the 6 pillars or the 6 points of defining mental health. Feeling in control of yourself. You feel that you are able to you are in charge of your life, because most of the time people with not with so mental with good mental health, they feel that just they're going with the flow. They're unable to control things. They're unable to deal with with the day-to-day activities being in charge or in control for them. You have the self-esteem, the confident. You get up in the morning, you do what needs to be done, you feel you're in charge of your life, you feel you're confident this is what you need to do, and you're able to do it, and you're able to achieve it at the end of the day. So confidence is an important component of the overall well-being of the mental health. Feeling good about yourself. You're not feeling down. You're not feeling awkward. You're not feeling that you're being judged. You feel that I wish I haven't done or said, or what has been done or has been said. And also managing and expressing your own emotions. The ability of feeling safe, of sharing your feelings with others around you. We're not talking about going in public and talking about your own inner feelings, but feeling comfortable to be able to share this or express yourself emotionally in different settings and circumstances is also very important and very vital. And suppressing these feelings is also very unhealthy. And also building and maintaining good relationships with others around you, and this is a key factor. From my experience in the private practice as a psychotherapist, I come to see that this is probably one of the most critical points that people needs to pay attention to. And I know that at a certain point we'll be exploring when we need to be mindful about our own mental health and when should we be reaching out for help.
It's much to think about.
Uh-huh.
The idea that it's crazy. And 1 out of 4 people has mental health issues. That's 1 per household minimum. Like if you have, I don't know what the average household size, but I imagine it would be about 4.
Mhm.
So 1 in 4. That's subhanallah.
It's quite, as I said again, we're not talking about
Mental
illnesses. We're talking
Yeah.
about mental health versus being unhealthy, and we're talking about certain abnormal psychology sicknesses that are needs to psychiatrist's attention, or admitting to hospitals. We're talking about the state of well-being and being able to live a productive life.
Do you think there are, just again trying to wrap my head around this like increase in people with mental health issues?
Mm-hmm.
Do you think this is a result, or like do you think there are any factors in the age and time, in the time and place that we live in, that contribute to this?
Yeah, precisely. From my own experience again, and I keep referring back to my own experience because I said again, the academia is in the books, online, the research, and all the details. But from my observation, there is significant there's like one population I see that being more affected than other population, which is the youth population, adolescents generally speaking. And in my assessment, adolescence extends beyond the teens life, extends to the tweens even, and beyond that. And for some reason mental health is impacted severely with this population. Now, as to why specifically, from my my experience, this is the case. It got to do a lot with the lifestyle, with the expectations, with the culture, with the environment. Many families come to me reporting, the mental health issues of their own children, or the mental illnesses of their children. And there's overlap. We will come to talk about that between mental health versus spiritual health, and what's the defining the line between the two. And I always try to bring to the attention of parents and generally in the community that the adolescent population is the most vulnerable population. Now, again, this is not only to say our community is having this issue. This is a broad issue in the society, even globally around on the earth. Now we're living in a very challenging time. Think of it this way: you guys have been doing your exams. Think of the load of work you have been doing. Think about your other responsibilities in life. Some of you might have a job that needs to be looked at, because you have no choice, because of the loans, because of the expenses, because of different other things. You're also not individuals who are coming out of vacuum. You are members of your family. There's also issues that you need to deal with within your family, closest family members, and the extended family. And there are issues, as I said, in the community. There are also broader issues in the society. Islamophobia is a fact, and it's on the rise, unfortunately, and it's something we cannot deny and hide. And the impact of Islamophobia on mental health is huge. And when you think of all these factors that are involving into teens, or tweens, or in adolescents in general, their life, you will see there's a lot of stress. There's tremendous stress that is that is imposed on them. And the fact that teens in this particular stage of their life, they they're being introduced to adulthood, their cognitive ability increases, their physical abilities also emerges in a significant way. So there are a lot of changes physically, intellectually, emotionally, and hormonally in teens life. And that all play a big role in to make teens or adolescents more vulnerable than any other segment in the society or in the community. Now, keep in mind also, these factors we're talking about are also factors can affect the adult population or children's population. The family issues, the Islamophobia. We're living now in an environment where speaking your mind or expressing your own concerns or exercising the freedom of speech could be causing you to lose your own job. These are issues that are affecting adults. This is by itself is a huge factor of influence that could affect those who are in the workforce. And being unable to express yourself also is another factor that could cause for you to be not feeling so healthy or feeling well. So we're caught between I wanted to express myself, I want to stand for justice, I want to do something, but on the other side, I'm concerned I might be losing my job. If I lose my job, I'll be facing the consequences of having to deal with the issue of losing a job in difficult situation and circumstances right now economically in Canada. But at the same time, if I keep my mouth shut, but I feel deep inside, I'm portraying my own values and principles and the values and the rights of others who are being undermined. So when you look into these all factors, you will see that there are, there is something we need to be mindful about. So in a summary, yes, the adolescent population is more vulnerable, but also at the same time, that doesn't necessarily mean that other segments, whether childhood or children or adults, are immune. No, they're also impacted, but the severity or the level and the percentage of adolescents is far beyond the other two segments.
So I was hoping we could unpack the stigma, going back to the stigma issue. I think the most common form of backlash is, and maybe you might be able to shed some insight on this, being someone who, mashallah, you have a background in both Islamic studies and you could say, so to say, or so to speak, like Western secular uh, studies, I guess, pertaining to this field. So I think the most common issue that people have is the whole idea that mental health or therapy or psychiatric institutions, they're like un-Islamic. and
Mhm.
they, in many cases, aim to sneak in non-Islamic or even anti-Islamic ideas through their therapies or through their, I guess, procedures. Like, is that something that do you think that's fair? Do you think that there's
Yeah, well, I hear what you're saying. We're living in a secular environment.
Mhm.
We're and at the same time, beside the fact that we're living in a secular environment where the secularism have spilled on almost all aspects of our living, including mental health. So when mental health is introduced, it's introduced as away from spirituality or religion because of the stigma associated with religion being controlling people's life. Now there is also another factor we need to keep in mind that is worth of paying attention to, the fact that the Islamophobia has a huge and tremendous impact on our life as Muslims, and it also impacts the way we present ourselves even within mental health settings. So there is also the factor that the mental health practitioners might be having in as a perception towards Islam and Muslims. So when you look into these all three factors, you will see why there is a sort of a perception that says that, oh, mental health is not connected with religion, or being religious does not necessarily mean you are you're able to engage into mental health practices or therapy. Now, again, there's also one more factor that we need to keep in mind: the perception that we build around the way we see our faith. Most of the time, or sometimes, certain individuals, it's not generalized, it's just isolated, maybe perception that Muslims or believers don't have mental health issues. It's those who are far away from Allah, or those who are not practicing, or those who are not religious, are the ones who would be having mental health issues. Now, I remember back in time when I first started my practice in the hospital, I was, still young and still, not, so educated about this issue. And I was like, oh yeah, I think, Muslims don't have problems. Like, they don't have, physical health or mental health. And gradually, as I started my practice, to see there are, kids who are, having leukemia, there are kids who are having, heart problems, or kids with, with kidney issues, or, with different, health issues. And it's like, wait a minute. There's something here that I need to change about my perspective into the health in general, and more specifically about mental health, and whether whether this is something that that Muslims are immune from. Now, generally speaking, we know that Allah said in the Quran to Ibrahim alayhi salam, when he Ibrahim expressed himself to others around him, said, and speaking about his Lord, وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينِ. And if I were to be sick, then he's the one who will cure me. And we do also know that Ayub alayhi salam, Jacob, was an icon for how a person could be tested in his life. Now, again, yes, if of course, indeed, the way we look at sicknesses, the way we look at practices, completely different than other faith background or other cultural backgrounds, maybe. Now, this is also something that I have, developed early in my practice in this area of a practice. That is, I remember once attending a workshop in which I was sharing my own perspective into mental health, and I said what I do help people with is to help them make sense of the nonsense in their life. Meaning to say, you know, what would you say to a person who's going through physical sickness, or mental sickness, or what would you say to someone who's going through, severely challenging, difficulties in their life, whether it's war, whether it is imprisonment, unjust imprisonment, or whether it is, unfair, living environment. There's no, most of the time, logical reasons to provide for them. What would you say to a mom whose child is, born with severe, medical problems and suffering so much? There is a way to help people understand and help them be able to see things from an angle that would just make sense, because we're after all rational beings. Look throughout the Quran, Allah Azza addresses the mind. أفلم تكن لهم قلوب يعقلون بها إن في خلق السماوات والأرض. There are, Quran in general, it challenges our intellect, urges us to be mindful and exercising this tool that the mighty have given to us. We intend, generally speaking, to just make sense of everything. If something doesn't make sense, it stays in the back of our mind. It puzzles us. It annoys us. And if we were able to make sense of it, then boom, we can just like move on in our life. We build satisfaction. We build contentment, and then after that, whether it is good or not, that's a different story. Whether it's resolving the problem or not, that's a different story. But at least I want to make sense of it. So this is where comes religion into, not spirituality, religion into explaining what is happening in your life, whether it is good or bad. فأما الإنسان إذا ما ابتلاه ربه فأكرمه ونعمه فيقول ربي أكرمن وأما إذا ما ابتلاه فقدر عليه رزقه فيقول ربي أهانن. As for the human, when Allah Azza wa expands for them their provision, they become so content and happy. Allah Azza wa is honoring me. And quite the opposite, when our provision is tightened and we're being put through difficulties, then we feel challenged. We think that Allah Azza wa is remoting us or deserting us. And then Allah Azza wa after that, kalla. Nay, that's not the criteria in which you evaluate difficulties or ease. The difficulties or ease are not necessarily a signs of contentment of Allah the Mighty or the anger of God the Mighty onto individuals. Though we need to keep in mind also that as believers, as Muslims at least, we believe that we're faced with our own, the consequences of our own actions in life. For instance, if I am to be on the wrong path, if I were to be unjustly, dealing with people, and I continue to do that, feeling or believing that I'm doing good, then eventually I'm going to be, doing more wrong. But there will be moments when the Mighty sends you a signal, a calamity or a difficulty or a challenge will be placed in your path to make you stop, reflect, contemplate, evaluate. Am I in the right path? If I'm not in the right path, then I need to stop. I could see this as a punishment, as a sign from the Mighty Allah Azza to tell me, wait a minute, watching inappropriate materials online is not good. Though you're become addicted to it, that doesn't necessarily mean that you're doing good. Having not being caught doing this or that doesn't necessarily mean that you can get away with it. Lying or backbiting or stealing or oppressing your family members or being unjust or unfair to people around you, that if you have been able to do it, nothing is stopping you, doesn't necessarily mean that it's right. There will be times when you feel like, boom, something is happening to me. Why is this happening to me? And this is the state of the Muslim, all the time. Reflective. I need to reflect. I need to take the time to contemplate and reflect. Is this something that I need to stop and doing and adjust and move on in the right direction? Also, it could be, and this is also another important issue that we need to keep in mind, and this is what I say most of the time to my clients. Like for instance, what would you say to someone with handicapness, or severe mental health or physical health? There's no rational explanation to give to them. But when you tell them that Allah Azza wa Jal, إذا أحب عبدا ابتلاه, if Allah loves a servant, He would test him or her. So when you explain to people, yes, you're a good person, you've been punctual in your salah, you've been generous in your donation, you've been honest, you've been good with people around you, you've done everything possibly you could do as a human being, as a Muslim, the right way. Why are you going through challenge? Because that defeats the perception that if I'm doing something wrong, I'll be punished. Then vice versa, if I'm not doing anything wrong, I should be rewarded. Yes, of course. Well, that's the rewarding will be coming not in the form of materialistic provision, but it will be coming in something you feel inside you. That is, ألا بذكر الله تطمئن القلوب. By the remembrance of Allah, the hearts will achieve the contentment. Now, go back again. I say to people in general, Why was the Prophet sallallahu alaihi wasallam, was born orphan? Why did he, after birth, was separated from his own mother, biological mother, to go and live with his nursing mother, and then after 3 years he was detached from his nursing mother to go back again to his biological mother? Why after a few years, less than 2 years, he also lost his own biological mother? Why after that he lost his grandfather? Why he lived a poor, a difficult life through his childhood? Simply because Allah Azza Jal wants to make something out of him. Allah Azza Jal has been preparing the Prophet ﷺ, or had worked on preparing the Prophet, وَلِتُصْنَعَ عَلَى عَيْنِي, as he said to Musa alayhi salam, to become afterwards وَمَا أَرْسَلْنَاكَ إِلَّا رَحْمَةً لِلْعَالَمِينَ. So it could be that you're going through a difficulty or a challenge for a hikmah, a purpose, a wisdom that the mighty Allah Azza Jal is giving to you, so you become a person who is something different than the average person around you. You will be having different experience. And I come across a study. I remember back in time when I first studied, started my practice, and I'm doing was when I was doing my residency, that teens who go through difficulties proven to be more effective adults later on. And we know that children who demonstrate the ability to delay gratification have become more effective adults later on. So there is a correlation between pure testing and success in life. And also keep in mind that there is also a possibility that the mighty Allah Azza wa Jal wants to honor you. Now, that sounds a bit crazy. Allah Azza wa Jal wants to honor me, but He's testing me. How does that work? There is, I think, a saying, or something related to, reported from Musa alayhi salam, that when he communicated with Allah Azza wa Jal that ya Allah, X is from my followers. He's conscious, muttaqi, but yet he's going through difficulties. Why is he going through difficulties? Allah conveyed back to Musa, Ya Musa, this follower, this conscious, this muttaqi, has been asking me for a status in Al Jannah that his own deeds are not enabling him to get to that level. So I am giving him a bit of, challenges in this life, because whatever we go through in this life is nothing compared to the hereafter, so that his rank will be raised and he will be qualified to be your companion in Al Jannah. So when we look into these things, this would make sense into creating a balance, or an understanding to what does difficulties mean to us as Muslims, and how we can relate that to our mental health. Now, again, remember what I said at the beginning, that if we are unable to make sense of anything in the life, this causes disruption to our life. But if we were able to make sense of whatever we're dealing with, then we feel the contentment. And that's exactly one of the pillars I use in my mental health practice, helping providing therapy to people. Number one is, we need to first of all establish that understanding that you need to make sense of what you're going through. Whether it is stop and reflect and contemplate and change, whether you are being selected by Allah Azza the Mighty, whether you are being loved by Allah Azza Jal, whether you're being supplemented, and all these understandings need to be defined, and this will create the balance between the mental health and the understanding or difficulties in life.
طيب, جزاك الله خير. You talked about the importance of like seeking out psychotherapy and the secular and the Muslim aspect, and like how they combine, how they complement each other, how the Islamic side is very important as well. I just wanted to go back to the secular side, because a lot of people, they seek the secular side more, and or even as a starting point, at least, even people who do seek the Muslim or Islamic psychotherapy, so to speak, they also seek the traditional Western form of psychotherapy. And with that, sometimes some people say it could be like an ideology more than a methodology. So are there any things? I mean, there are. We know that there are, but what are some of the things that people should watch out for when they seek out this kind of psychotherapy?
Yeah, I agree. I agree, with you to a certain extent, that most of the psychotherapy models that are presented, they tackle one aspect of the Islamic theology, existential, therapy, or different other therapies. The way that each model of therapy is based on narrow perspective. Now, however, when it comes to Islamic psychotherapy, or dealing or balancing between therapy, secular therapy, and Islamic perspective of therapy. Islam's or Islamic perspective comes to strike a balance, because let's get back one step backward. Now, with mental sicknesses, many people come to me and say, okay, well, my child is having issues with they're talking to themselves, they're exposing certain behaviors, they're talking about seeing things or hearing voices, or issues of that nature. And I say to them from the get-go, these are signs of schizophrenia. Now, it from our perspective as Muslim, we know for a fact also that there is something called sihr, and sihr is not something that we deny as Muslims. Allah mentioned that in the Quran. وما هم بضارين به من أحد إلا بإذن الله ويتعلمون ما يضرهم ولا ينفعهم ولقد علموا لمن اشتراه ما له في الآخرة من خلاق. So وما كفر سليمان ولكن الشياطين كفروا يعلمون الناس السحر. So السحر is mentioned in the Quran, even like in the shortest surah of the Quran, قل أعوذ برب الفلق من شر ما خلق ومن شر غاسق إذا وقب ومن شر النفاثات في العقد ومن شر حاسد إذا حسد. So it's a fact, it's an established fact that we know that sihr exists.
Just to be clear, نفاثات في العقد is the part about magic.
Exactly, that's my point.
Yeah.
So blowing in the nuts, blowing
Yes.
in the nuts is the act of creating black magic.
Mhm.
So this is a fact established to us in our religion as Muslims. So we believe firmly in the existence of black magic. We also believe in what's so-called jinn, because we know that Allah created human and jinn and created angels. Now, what's important is to strike a balance between these understandings and the practical understanding, as well as the professional perspective of therapy. Now, when people come to me with issues like this, I say to them up front, as a therapist, I'm unable to do much to you. Yes, I understand. Even with mental illnesses, in supportive environment, the spiritual aspect of support would play a huge role into the overall well-being and the treatment process with mental sicknesses. But it is important to look at the right way for treatment, which is through medications. Now, alhamdulillah, the community right now is growing and there we have many professionals, psychiatrists, psychotherapists, name it, and they're all sharing these ideas. Yes, there is a similarity between sihr symptoms, between jinn position, which is something that we also believe in, كالذي يتخبطه الشيطان من المس, as it's mentioned in the Quran. Then, and also at the same time with the treatment, medical, with this description of schizophrenic issues. Now, I say it up front to my clients. I'm not a person who has similar ability like Umar al-Khattab, who put his hand on someone and recited al-Fatiha, and Allah Azza gave the cure to the person. Now, if we were to have Rabbaniyin, scholars who have the ability to recite the Quran and heal people with it, which is a fact also. So we firmly believe, without any doubts, that Quran is healing physically as well as spiritually and mentally. That's out of the question. We're not denying that. Now, do we have that now? As far I know from my observation into our in our at least to my environment in the GTAH or in Canada broadly, I don't see any person who has that ability. So what we need to do alternatively, and this is what I advise and people with, is go to the medical facility. Let your children be admitted to the mental health facility, or let your loved one be admitted to the mental health facility. Let them take the medications to start with. And we inform the medical team that we need to incorporate with the medical treatment the spiritual, support. And this is where we can subsidize and improve the quality of the treatment and fast track it. And from there, we move forward into maintaining the spiritual and mental health well-being of that individuals with spiritual connectivity. and fulfillment, and to ensure that the relapse would not be happening and possible after that. Now, so we need, as I said, to strike a balance between what is medically and what is mentally and what is spiritually, so we're able to create balance that would help people to move forward. Otherwise, we'll be creating chaos. There's a lot of fraud, that people claim to be doing, certain issues which they have no base, no scientific base to it. So that would hopefully create a balance between the three understandings, or these, two different understandings.
Okay.
Yeah.
Well, the three understandings being, you said, mental, physical, and spiritual.
Exactly. So, and also balancing between, what is secular and what is non-secular. So
Mhm.
again, maybe I should be more elaborative on this perspective about the therapy, the Islamic integrative, therapy versus the secular, therapy of counseling. Now, as I said again, the Western perspective, as we said in the beginning, is based on secular perspective. So there's, there are some models that, believe in spirituality, but again, we need to have something that's more wholesome, more comprehensive. Look at the human as physical, as mind, as a spirit, and look into these all three components altogether. And this is where the Islamic model of therapy comes in effect. And in my cases, I integrate between most of the contemporary models of therapy and understandings of therapy, and incorporate that with the Islamic understanding. And that's why majority of those who come to me for therapy, they say to be upfront, we went to the mainstream therapy, we did not get what we were looking for. Not to say that the mainstream therapy is not effective. It is, because I'm using that as well, but it lacks that spiritual, religious, and I'm being very specific, religious and spiritual component into it, which is what would be a very important component into the overall process of the therapy.
There's another piece of criticism that's lodged against psychotherapy from Muslims, and that's the fact that they say, "No, tawakkul ala Allah, place your trust in Allah subhanahu wa taala."
Mhm.
And some see that in going to psychotherapy, there's that aspect of seeking help away, or like not from Allah subhanahu wa ta'ala directly.
Yeah. Well, again, the tawakkul on Allah Azza wa Jal is different than at tawakkul ala Allah. And I've got some clients who come to me with the same issues. They're mutawakkilin. They're saying that, oh, we don't need the therapy. We don't need to do this. We didn't need to do this. I believe firmly that, Allah is going to provide for me regardless. I say to them, of course, Allah Azza wa Jal is going to provide for you as He provide for the bird. They leave early in the morning from their nest and come back again with full tummy. That's out of the question. But the part you need to be aware of is that you need to do your due diligence. You need to, do what is expected from you. وَإِذَا مَرَضْتُ فَهُوَ يَشْفِينَ. But at the same time, we're instructed to seek the treatment to be able to get, the outcomes. Again, remember what I said to you about how Quran is healing, both physically, spiritually, mentally to us. But do we have those rabbaniyin scholars who are able to put their hands on someone's head and read, or on the ailing part of that person's body, and do the ruqya sharia, and get the healing? That's a fact. We believe in that. We're not denying that, because clearly Quran says it. But again, do we have that? We don't have it. So what we strike a balance between taking by the asbab, doing what it needs. I need to plant the seed to allow the seed to grow. The seed would not grow. I would not be, by the end of the season, planting season, having crops if I don't plant the seed. So I need to put the seed. Is my action of putting the seed in the ground what would make the plant to grow and bring big multiple folds in return? No, because this is the action of Allah Azza wa Jal. But I need to start with that. I need to put that seed, and from there the outcomes will be coming. So the same is to be said when I come, seeking the whether physical treatment or mental treatment. I need to take my own, practical, steps of reaching out for medical help, believing firmly that it's not the doctor nor the medication which will be doing the curing or the treatment for me. These are only tools that the mighty have facilitated for the process of my healing. So when I go to the doctors and when I take the medications or when I go to therapy, I firmly believe in what Allah Azza will be providing to me. So now, when it comes to mental health, yes, indeed, we believe firmly, as I said, in dua. We believe firmly in believing in Allah Azza wa Jal. We believe firmly into living your life as, as a Muslim, which would bring the tuma'nina to your life. That's out of the question. But now, do I need also to deal with my own mental health issues? Yes. Why? Because Islam, Quran speaks about it. وَنَفْسٍ وَمَا سَوَّاهَا فَأَلْهَمَهَا فُجُورَهَا وَتَقْوَاهَا. As a matter of the fact, when you look into the Quran, there are multiple ayat that speaks about the psychology of a human being. خلق الإنسان هلوعا إذا مسه الشر جزوعا وإذا مسه الخير منوعا إلا المصلين. And then Allah describes the characteristics of the musallin. So human in nature are susceptible to be agitated easily, anxiety, stress, panic attacks. And Allah Azza also described the nature of the human being. وإذا مس الإنسان الضر دعانا لجنبه أو قاعدا أو قائما. When a calamity befalls unto human, they will be turning to Allah Azza wa Jal and supplicate to Him in different positions, while they're standing, while they're sitting, while they're laying down. And meaning to say, if they were to be able to stand and salah, they will do it. Or if they are unable to do it, and while standing, they're sitting on the chair and praying to Allah Azza wa Jal, supplicating to Him. Even if you were to be in the hospital, laying on the bed, you're expected also to engage in your salah and supplicate to Allah for shifa. And at the same time, also Azza wa Jal said, وَإِذَا أَذَقْنَا الْإِنسَانَ وَلَئِنْ أَذَقْنَا الْإِنسَانَ مِنَّا رَحْمَةً ثُمَّ نَزَعْنَاهَا مِنْهُ إِنَّهُ لَيَئُوسٌ مِنْ بَعْدِ ضَرَّاءٍ مَسَّتْهُ وَلَئِنْ أَذَقْنَا الْإِنسَانَ مِنَّا رَحْمَةً ثُمَّ نَزَعْنَاهَا مِنْهُ إِنَّهُ لَيَئُوسٌ كَفُورٌ. If we were to provide and if we allow the human to taste rahmah of Allah Azza wa Jal and then withhold it back away from, he becomes ya'us, kafur, exaggerated form of yes and kufur, giving up and rejection. And وَلَئِنْ أَذَقْنَاهُ نَعْمَاءَ بَعْضَ ضَرَّاءَ مَسَّتْهُ. If we were to give him something, na'ma is like different than ni'ma, something from the attractions of this life. After calamity, then he became فَإِنَّهُ لَفَرِحٌ فَخُورٌ, becomes so proud and arrogant of his own achievements. And then after that, Allah Jal immediately exclude from these two things إِلَّا الَّذِينَ صبروا وعملوا الصالحات أولئك لهم مغفرة وأجر كبير. So when you look into these ayat, they clearly speak about human psychology. So why do we create this conundrum or this perspective that we need to separate mental health from Islam, or there is no connection between the two? Well, the connection is very clear in the Quran. As a matter of the fact, understanding it, like فلعلك باخع نفسك على آثارهم لم يكونوا مؤمنين. ألم نشرح لك صدرك ووضعنا عنك وزرك الذي أنقض ظهرك ورفعنا لك ذكرك. There are multiple ayat. Musa alayhi salam asked Allah Azza ishrah li sadri, expand for me my chest, Ya Allah, so I'm able to engage into the job of da'wah. So again, Musa was asking Allah Azza to help him become in the optimum side of the mental health, to be able to fulfill his responsibility. And this is where we need to create the connection between the understanding of these ayat and the understanding of the deen versus the understanding of the secular perspective of the psychotherapy. Now again, do I say that the Islamic or mainstream psychotherapy is not effective? I'm not here about promoting business, but from my observation, from what I have seen, there is this element that is missing in the mainstream psychotherapy. Now again, when they talk about spirituality, are they able to fulfill that? They could possibly be able to do it, but there's also the religious and spiritual component that needs to be fulfilled, and that is most of the time provided from the experienced Muslim psychotherapists who are integrating the mainstream psychotherapy into the Islamic perspective.
It's very important to make that elaboration. That distinction.
It is very important, because I'm telling you from my personal experience and observation is that so many people um, they feel that it's not working. I'm reaching a dead end. They gave up. They become so depressed, and it's like it's not working. As it's just I go there, I don't get the desired outcome. Now, walillah alhamd, not to say that from the other side you will get 100%, because it's based on the experience, the level of expertise, and the and some other factors you will be getting, but the chances you will be getting much more satisfactory outcomes than when you go to the ministry.
Mhm. Speaking on the Western side now, this time, we know that a lot of the Western understandings of, or the Western understanding of mental illnesses could be incomplete. And we know this because, in light of new data, there's always this reinterpretation, reclassification of the different mental health illnesses and the tools and the methods that are used to treat them. So, given that in mind, how do we go into that, I guess, the field of, I guess, Western medicine without harming ourselves or risking harming ourselves?
Do you mean as expertise is trying to explore this, or recipients?
I think it's more, the questions are more for the recipients,
Uh-huh.
because, and you know how in medicine, yeah, you have different medicines, and then you might be worried that you might be subjecting yourself to the wrong treatment,
Hmm.
and then in that process harming yourself.
True. So again, let's go back a little bit and backtrack. uh, you know uh, Spirituality in psychotherapy is, in some models, are seen as an important component. Like, for instance, in alcohol, in addiction treatments, spirituality is very vivid. But what is important is, again, to include not only spirituality but religion. And we're not here talking about extremism or fanaticism and all the details. No, we're talking about providing a comprehensive model. Now, the same is to be said when it comes to seeking treatment, from the mainstream. Now, we need to strike a balance. Like, I said, like, when my clients come to me with children with mental illnesses, I say to them clearly, go seek treatment from your psychiatry or from your medical doctor, and let's work along with your medical doctor to be able to reach a balanced approach in your treatment plan. Now, most health institutions are now, realizing the importance of spiritual component. Many hospital settings, many, even, practitioners are trying to be aware and mindful of the spiritual component and religious component in the whole overall plan of the treatment. Hospitals hire chaplains now, though that I'm a bit optimistic, skeptical about the notion that hiring one size fits all, chaplain, where a chaplain serves all communities with all spiritual needs. Facilitating for them their spiritual and religious needs is something, and providing for them spiritual needs and religious needs is another thing. So yes, now the mainstream health institutions are now being aware of it. So I encourage people, and I said that like lately I have been dealing with a case, and I said to the loved ones of that person who's in mental health facility, I said to them, reach out to the medical team, tell them we need to facilitate through the spiritual care department the spiritual fulfillment for our loved one, and we need to ensure that patient is able to get that religious and the spiritual component included in the treatment process. Because when the patients start talking about hallucinating, and talking about seeing things, or talking about religious issues, or talking about how there's like he needs to read Quran, or he needs to read certain passages from the Quran, the mainstream therapy would not understand what this person is talking about. Here comes the involvement of the spiritual leadership or the religious leadership that is trained in health settings to be able to provide that need for them. And go between two brackets, I have the experience of working in hospital as a chaplain, a spiritual care provider, and I could see the importance of guiding people in health settings. If you are dealing with a difficult situation, by having an extremistic, member of the family, and you're getting to the point where a critical decision needs to be taken about the health treat or the treatment, process of that individual. That treatment, options that provided for you could sound as something contradict with your own principles and values, and religious beliefs. So how you strike a balance, where do you need to get the guidance? You need to get the guidance not from the scholar who's, back home, has no understanding to the to the practices of or the medical practices we have here in Canada, nor about the imam who's trained to be an imam in the community by, doing the imam's responsibility and job in the, in the mosque. But you need to look for someone who's trained in both areas to be able to provide for you the right guidance and answer the questions that are essential for you to be able to, to ask, in order for you to have a balanced approach for your, for your treatment, whether it is in the health mental, in the health, physical health or mental health, field.
So that's with regards to the Western side.
Hmm.
Moving to the Muslim, to the Islamic side, I guess, or the Islamic lens
Hmm.
of tackling mental health, mental issues, mental illnesses. I'm still trying to wrap my head around the one in four people having issues with. I know you said mental health issues, not necessarily mental illnesses, but that also means that there's a lot of people suffering from mental illnesses. So, as a Muslim, um, how does one differentiate, or yani, at what point in one's struggle with mental illness should they look to turn towards therapy? And is there a sequence of things that they should try before go in that direction?
Yeah. Now, remember the six things we were talking about in terms of what defines mental health. Number one is resilience, feeling in control of your life, feeling confident, feeling good about yourself, managing and expressing yourself emotions, and building and maintaining good relationships with people around you. This could be, probably these six things would be the gauge for you to be able to sense where when do I need to reach out for help. For instance, if you feel that your life is a roller coaster, you feel that you're just dragging your feet, you feel that physically you're not in an optimum physical health, you feel that your relationship with people around you is not the best, you keep doubting whether it's them or me. Now, if it is happening at home, happening at work, happening in the mosque or in the community, then there's a common factor, there's a thread that you need to to pay attention. Now, this is where you need to reach out. Now, we need to get to the level where we feel comfortable to book an appointment and say that I'm just booking an appointment to just see where things are right now for me in my life. Am I, like, doing well, or do I need some attention? It's like when you feel not well and you go to the medical, to your family doctor and say, like, there's something wrong that is bothering me. And then the doctor will be doing the diagnosis, by doing blood test, x-rays, all the details, and then based on the reports, getting back to the doctor, will be giving you an idea of what's really happening to you physically. Now, the same needs to be done about our mental health. If you feel things are not optimal, or if you're not excited, we're not engaged into our day-to-day activities with optimism, with full potentials, then there is something wrong. Now, does that mean I have a mental health issues? Does that mean I'm a person should be seen as less competent? No, that's not true. you know the Prophet ﷺ himself, Allah said to him, when the wahi, Jibril, stopped, coming back to him, he felt the tightness in his chest. So Allah said to him, comforted him, don't feel bad, and at the same time, when he was so anxious, to help the people of Quraysh to believe in the deen of Allah Azza Jal, he felt the tightness in his chest. Relax, take it easy. You know, when the Prophet ﷺ went to Al-Ta'if and came back again, bleeding. He sat in the garden and prayed to Allah Azza wa Jalla in the darkness of the night, and he said this lovely, beautiful du'a, in which he expressed his sorrow feelings to Allah Azza wa Jalla. There's nothing wrong with you sharing, your feelings or your vulnerability to someone that you feel that they're able to empower you. And this is where we need to know to draw the lines between when I am complaining and when I am seeking professional help. Because the perception runs always, oh, you're not exercising patience. I see it a lot, like even in my practice in the hospital, I see people coming to visit, patients, and there's, oh, stop, you're whining or you're talking. You should not be talking. Well, where did you get that from? You know, Sabr, patience, is a congregational ibadah similar to Salat al-Jum'ah. Salat al-Jum'ah is done in congregational setting. Ramadan is done also in congregational setting. So the same is to be said about, sabr, patience. And the same is to be said about, mental health. There's difference between going outside and sharing on social media, oh, this is what's happening for me, this is unfair, how could this happen to me, look, I have done everything, I am like, this is who I am, why would this happen to me? That's complaining. Versus when you reach out to someone that you trust, that that he is or she is a person who's trustworthy, and that they can be of support for you. The Prophet ﷺ, in the most difficult moment in his da'wah, when he saw Jibreel for the first time, he was overwhelmed. He was terrified, in another word. So what he did is he immediately came back to Khadija radiallahu anha saying, Zammiluni, Zammiluni. He was shivering. So Khadija radiallahu anha did not only cover him with a blanket, she covered him with her own love and compassion. And she gave him that, that comfort he needs. And then, the Prophet ﷺ started sharing with her what he have experienced. And then in return, she said to him, Kalla, by Allah, Allah will not let you down. So now the Prophet ﷺ could have gone to Mecca, to the Haram, and to the Kaaba, where he was recognized as one of the leaders of Mecca, and start complaining to people, oh, look at this is what's happening to me, how fair this is. I am, from the Hashemitic family. He did not do that, but he did share what he experienced with Khadija radiallahu anha. Now, Khadija is his closest, person in his life. She's his wife, the one who showered him with her love and support and all the details. She also was the right person with the wisdom and the skills to give him the empathy and the support he needed to be able to deal with that particular situation. So again, when you go through certain, challenge in your life, or when you feel that your life is in a roller coaster, reach out for that particular person whom you feel that they have the ability to accommodate you, B, they have the compassion and the empathy to share with you, B, they have the expertise or at least the knowledge to be able to guide you in this difficult situation. If none of these are available for people around you, reach out for professional support. I know that sometimes it's a bit challenging because it's not something covered by OHIP, but it is something that is worth considering. Or there are, alhamdulillah, some facilities or some mental health institutions within our community who are trying to accommodate the different needs of the community by offering something that is professional, yet it is also affordable.
Hmm. Interesting. So I wanted to ask you, this is something that a lot of people seem to be discussing. Like, what are your thoughts on preemptive or maintenance therapy?
Yeah. Well, as we say it, dirham wiqaya khairu min qintar ilaj. So the primitive or being aware and work on maintaining a good mental health will eventually be preventative to you to major mental health issues that could be coming along down the road. Now, I said spending 1 dirham into prevention is better than spending 10 dirham in intervention. So that has been said. We need to look into certain mechanism within our community that can help us to raise awareness, provide the platform that can provide the support, spiritual, religious, and emotional and social support to individuals, so they are able to be in that area where they're getting the support needed to prevent further problems from popping, or to prevent the relapse, as we said in the past, of mental health issues that have been dealt with in the past. So yeah, I agree with you 100%. Now, This is, as I said, this is not an individual responsibility. It is an individual responsibility to a certain extent by being, proactive, by, always do the, the checklist for yourself. Where I am standing, do I, have a problem with the 6 issues that I have been dealing with? My resilience, my self-esteem, my confidence, my sharing, my emotions, I have, certain issues that I need to be aware of. Also, at the same time, maintain your spiritual, fulfillment, and as well as religious fulfillment. What do I mean by that? Now, um, there, as a Muslim, you're expected to be engaged into certain rituals, ibadat. One of the main outcomes of these ibadat is help you to fulfill your spiritual fulfillment and your spiritual needs. And that, being engaged in that in a practical manner and in a professional perspective, in a manner, would help to contribute a lot into your mental health well-being, and will also help you contribute a lot into the relapsing of the, prevent the relapse of the mental health issues that you have dealt with in the past. So yes, there are, issues that needs to be done on a personal level, doing your ibadat, engage in your, your Quran recitation, exercising, because some of the things that we believe in, that exercising is bid'ah, or taking care of your, physical health is bid'ah, or it's irrelevant, or it's not necessarily, when in reality, wa'iddu, Allah Azza wa Jalla asks us to be prepared. المؤمن القوي خير من المؤمن الضعيف وفي كل خير. The strong believer is much, better in the skill of Allah Azza wa Jalla than the weak believer, and they're both equal in the eyes
Mhm.
and sight of Allah Azza
Yeah,
wa Jalla.
the strength is encompassing everything. It's
Exactly.
not specific to one thing.
Physically, emotionally, religiously, and at the same time, gauge yourself. If you're isolated, you're not, regular attendees to the masjid, you're not attending the, the activities that are, organized in the masjid or in the community, then there's something of concern. And also, pay attention to your loved one around you. If you're a parent, you see a child who's not, engaged, they're lacking the social skills that they need in their life, then this is maybe a chance for you to, pitch in and try to help them improve that, these skills. So, and at the same time, from the other side, what you guys are doing in terms of providing different activities that can, support the mental health well-being of the members of the community. All these activities you have been running around, the conferences, the qiyam al-layl, the iftarat that you have organized, salat al-jumu'ah, the salah on a regular basis, for the, and providing spiritual and counseling support for, the students. These are all factors that can, be preventative, and also at the same times can be maintaining the overall, well-being of the mental health for individuals in our community.
Interesting. So just, I'm actually curious now. So
Mhm.
people who, let's, like you mentioned, how these resources that the MSA provides and the different masajid,
Yeah.
people who attend those, like, do you find that, or sorry, like the regular Muslims who do seek help, are they lacking like these kinds of engagement?
Yeah.
For
Well, let's also not get into the trap we were, talking about earlier.
mm,
Muslims who are active are not supposed to be, falling into physical or or spiritual or even mental health. No, that's not true.
mhm,
Abu Hamid al-Ghazali, I remember reading in one of his books that he have taken some time away from his, students. Why? He felt depressed.
mm,
This is, um, a mental health state that many of us are susceptible, or expected to fall in, in whenever the circumstances around us pushes us towards it. For
mm.
instance, we had COVID not too long ago. now
Yes.
now that pandemic have caused illness to people. Now it's the environmental factor, the spreading of the virus around, and all the details. So does that mean, Muslims were immune from, being affected with COVID? No. The same thing, by the way, as one of the impacts of COVID was the mental health. Depression was becoming a huge issue. And was it only, that the, Muslims were immune or exempted from falling into that? That's not true. But where Muslims who are very active both in their spiritual, engagement, and their, social activities, where their depression was reduced, was mild, yes, that's something we cannot deny. And this is also another important issue that we need to keep in mind, that When we do our ibadat rituals, there's something that is now known as mindfulness. You heard about this term a lot. It's becoming now the trend where mindfulness, yoga, meditation, all the details. Now, this is a built-in feature in our ibadat, and that's why you're expected minimum to pray to Allah 5 times a day. But we always say that not any salah, it has to be a salah with khushu'. What does khushu' mean? Khushu' means to be mindful. And also at the same time, Allah tell us, أَفَلَا يَتَدَبَّرُونَ الْقُرْآنَ, shall they not ponder and contemplate on the Quran? And also at the same time, even when you're doing your adhkar, whether it is tasbih or istighfar or salat al nabi sallallahu wasalam, it is not to be things to be uttered by the mouth only. It needs to be something that felt by the mind and the heart. And this is what mindfulness is all about, by the way. I'm trained as a mindfulness psychocognitive based therapist, because I believe in the power of engaging into mindful rituals and ibadat that can empower your immunity. Now, again, you have a high immune system. You're attacked by a virus or bacteria. Now, if that bacteria is not going to say, "Oh, wait a minute, this guy is Muslim or he has high immune, I'm not going to be able to attack him." Well, I mean, it could attack you. The impact of that could be like 5%, could be 25%, could be 50%, could be 100%, based on how active your immune system is. So the same is to be said with your mental health. You're very active, you're less active, or you happen to be having also certain sicknesses. That doesn't necessarily mean that you're not a good believer. No, your involvement is contributing to your overall mental health well-being, and contributes to the treatment and the prevention strategy that you're working on.
Mm-hmm. Interesting. And then I think another question that a lot of people have is with regards to, I guess, where they should seek help. If someone is feeling down, you could seek help from an imam, a sheikh, a scholar, and in many cases it would work because the issue could be faith-based, or the person could be receptive to that kind of help. In other cases, of course, you need therapy. So what's like when do you know? When do I know as a person whether I should seek the imam sheikh route or the psychotherapist route?
Now, this is what we need to establish, as a social being, because after all, we're a spiritual being with social activities and and physical appearance. Now, as an individual who lives a healthy life, you need to have social connections. If you are seeing that there's a problem with your social activities or your social connection, then you need to revisit that. Look into ways to improve your social connectivity with people around you. And it's an art. It's a learned skill. How are you able to lower your guards and be able to connect with people around you, build friendships. There's something called BBF or BFF.
Yeah.
I always make a joke about it. So if you don't have a good friend, and we mean by that, you don't have a brother or a sister, not of a kinship, but in the faith, that you're able to connect and relate with, because al muslim mar'at akhul muslim. You are a mirror for your own brother or your own sister, a brother to a brother. If you do not have that, then I think there's an issue. If you have it, this is your first line. I could sit with Ahmad and say, Ahmad, you're my brother for the sake of Allah Azza Jal. We've been together. You know me from inside out, and I know you from inside out. Lately I've been, having these issues. Now I know Ahmad would not be having a hidden agenda. Would probably be advising me, in the right way. Would say, oh yeah, no, it's okay. It's just like a mild, depression feeling or whatever it is. It's something issue that you need to, or would be giving me more advices on how to deal with it, or would encourage me to be more engaged with certain activities that would prevent this from further escalating. If that didn't work, then you could be reaching out for your next level. Reach out if you're a young man or a young woman, for your family members, your parents. Say, okay, look, listen, I know this is not something you would be happy to hear me talking about, but I do have these feelings, I do have these thoughts in my mind, and I do have this issue that I'm dealing with, and I think I should be talking to you about it. Now, parents could be educated, and they know how to deal with this issue. they would be probably doing an assessment, immediate assessment, and go take it from there. Whether they should go to the imam in the masjid, or they should be, seeking counseling, or they should be reaching out for a therapist, in the community. Now, here's the challenge. If the parents, with their defense mechanism, would say, "Oh, just brush it off. Don't let him talk about it. This is taboo. No, no, no. Just close it. Close the topic. Don't even open it." This is gonna, suppress the feeling and cause more harm. So, parents, please pay attention. Listen. It's not, a crisis, or it's not something that you need to feel ashamed of if your child come to you and talk about their mental health issues. Rather, they should be, supported and encouraged to share with you. If you do not have the ability to deal with it, reach out. Again, majority of imams in general, they're good in counseling. And there's a difference between counseling and therapy. Counseling is an advice you'll be getting from a friend, or from, an imam, or from an elder, from, an activist in the community, based on their experience, and they will be guiding you. Most of the time, it's a done deal. Alhamdulillah, everything is fine. But when it comes to therapy, therapy is a treatment is done through a treatment plan that is, a mutually agreed on between the two sides, the client and the therapist, within a certain, parameter, within certain parameters. So it is, a plan with objectives and goals to be achieved, and with clear steps and process of achieving, outcomes. So this is when you need to reach out for the professional help. Now, as where you should be going for this, most people, or majority of people, have an extended health, plans, so they can, reach out for a therapist. Most of the time, it's covered with their extended health plan. If not, then, there are some organizations. I'm not going to be, promoting names, but, Google online, and you'll find that there are some, mental health institutions or organizations who are promoting, good mental health, and they can provide for you, support or help, or even therapy, with subsidized, income, with subsidized, cost. So this way, and alhamdulillah, like, I've been reached by some masjids, who are saying, we need to establish this as a service, integral service, in our masjid. So now gradually this is, increasing, and, the awareness is being raised, and now the masajids are getting to realize that they are not only about to provide 5 daily salawat and Eid salah and Jum'ah khutbah, and that's about it. There is more than, this into the masjid for our community. The recreational activities, the social activities, the mental health, therapy and support activities as well. So these are all things, inshallah, should be helpful. So this is what you need to look for, as if you feel that there is something you need, to reach out for.
جزاكم الله خير. Yeah.
وياكم إن شاء الله.
طيب, and then just before we wrap up, there's one important question that is on the mind of a lot of Muslims, and that's regarding, if I feel that I can overcome my issues by becoming closer to Allah subhanahu wa ta'ala, what steps can I take to achieve that?
Now, let's redefine this question in a more practical way. Tazkiyat an-nafs, or coming close to Allah Azza wa Jal, or purifying your nafs, which is something that Quran highlights a lot. وَنَفْسٍ وَمَا سَوَاهَا فَأَلْهَمَهَا فُجُورَهَا وَتَقْوَاهَا.
قد أفلح من زكاها.
قد أفلح من زكاها وقد خاب من دساها. This concept of tazkiyat an-nafs, purifying of the nafs, is rooted in our faith, and that's why, in my assessment, psychology for Muslim community is not imported from the West. It's actually an integral part of our faith and belief and lifestyle. And because Quran is full of Quranic ayat that speaks about the human psychology, there are many hadith related to the psychology practice in the Prophet ﷺ's, sunnah, the story of the young man coming to ask the Prophet ﷺ for zina, and the process used in cognitive therapy to diffuse that perception in his mind. There are many issues similar to that. And in my observation, I was listening to Kitab Ihya Ulumuddin, and I said, like,
Al-Ghazali.
It's an amazing book. It's the book of psychology. If you take the cover off and put a cover with psychology book of Islam, you would not, feel the difference, because what tazkiyat al-anfus is all about is about, creating a positive health, mental health. And I need to admit, that the expert in this is, mashallah, is Dr. Rani Awad. She's the expert in this, this area. She's a researcher, she's a psychiatry. She's done a lot of, talks on, and I encourage people to go and listen to her talks and her publications, read her publications, because she have done an amazing job into, reintroducing the concepts of psychology from an Islamic perspective, and the roots of it in the Muslim scientists. So going back again, you'll be surprised to hear that in almost all my practice of, with as a professional psychotherapist, I do follow the strategies and the models of therapy, but at the end of it, I need to use, spirituality or religion or rituals to help the client be able to achieve the positive outcomes. So there comes, if we're dealing with, anxiety, how are we able to defeat the anxiety? Anxiety will be coming from wrong perceptions that people develop as a result of, previous experience in their life. So we go back to the concept of tawheed, and the concept of aqidah, and the concept of, tawakkul ala Allah azza wa jal, and the concept of believing that وَعْلَمْ لَوْ أَنَّ الْأُمَّةَ قَدْ اجْتَمَعُوا عَلَى أَنْ يَضُرُّوكَ أَنْ يَنْفَعُوكَ لَنْ يَنْفَعُوكَ أَوْ يَضُرُّوكَ, if the whole ummah were to get together to harm you or to benefit you, would not be able to do so. وَمَا أَصَابَكُم مُّصِيبَةٍ فِي الْأَرْضِ وَلَا فِي أَنفُسِكُمْ إِلَّا فِي كِتَابٍ مِّن قَبْلِ أَن نَّبْرَأَهَا. So you will find that there is always a reference back to the religion and spirituality. So vice versa, as we said, as a precaution, as a primitive, actions, your engagement into tazkiyat al-nafs, you're, having a sheikh, quote unquote, or having a group, or having a BFF who is your companion in this journey of the tazkiyah is extremely helpful, because by yourself you're unable to see your own blind spots, but when you have someone who's around you and helping you with this journey, this is where you will be able to see, the impact. And that's why, like in our deen, in our faith, we like, we look high to the imam, we look high to the murabbi. There is a concept called in our faith, that murabbi. What's murabbi? The rabbi, the one who will discipline, who would, look into your shortcomings. And that's why it's important for the parents to be vigilant from early, stages in their lives, the life of their children, to assess their psychology, to see if they have, traits of narcissism, if they have, potential depression, if they are, with social, phobia, or with, they lack the social skills, or they're having, issues of expressing themselves, or being comfortable in public. These are all things that, would be dealt with early in stages in their life. And this is where comes again the involvement of religion, where you have your sheikh, or you have your group, or your brothers and sisters, and the group you belong to, where you are being, able to see your own blind spots, and being assisted to deal with your own shortcomings. And this is where the positive reinforcement, because when you, as Ahmed, as my brother, for the sake of Allah Azza wa Jal, you come to me and say, Sheikh Ayman, you know what, there is a problem that, I saw you doing this thing, or I feel that this is something that you're not paying attention to. You give this to me as a gift, and I will be, working on it, and you will be giving me the reinforcement, or the positive feedback. So this is where, the connection between the two. Can we do that only in serious cases, and not turn to, professionals for help? No, I don't think so. So as again, when it comes to, physical illness, like, let's say, Allah forbid, someone has, heart problems, we can go to Quran Ruqya Shar'iyya. Again, if we have someone like Umar Khattab, alhamdulillah, done deal. But if we do not have something like that, we need to balance. We need to go for treatment, as well as for the, the spiritual fulfillment.
جزاكم خير. I always think about how the prophets عليهم السلام, how they tackled their anxiety, their fears. As you mentioned, موسى عليه السلام, ربي اشرح لي صدري, أيوب, what's his name, يعقوب عليه السلام, بيضت عيناه من الحزن فهو كظيم. His eyes went white. He lost his eyesight out of sadness and sorrow. So this is something that is even the best of mankind experiences, and just looking at the way they tackle it. Subhanallah, Surah Al-Anbiya, the surah of the prophets, something it's very interesting. Was looking at the surah, and you notice, you would think a surah about the prophets would talk about their achievements, but rather, if you look at the surah, it talks about them at their lowest points
Their tests.
and their tests,
Exactly.
and what they did with it. So وأيوب إذ نادى ربه أني مسني الضر.
الله أكبر.
ونوحا إذ نادى من قبل فاستجبنا له.
نعم.
وذنون يونس عليه السلام إذ ذهب مغاضبا فظل أن نقدر عليه فنادى في الظلمات أن لا إله إلا أنت سبحانك إني كنت من الظالمين. This is like the ultimate.
وزكريا إذ نادى ربه
ربي لا تذرني فردا وأنت خير الوارثين.
Which takes us to talk about dua.
Yeah, subhanallah.
So the first thing is you get the spiritual support, the support needed from your friends, but there also has to be something above and beyond. Like, look into the Prophet ﷺ's life. Khadija played a huge role. Like, in my assessment, every person until the day of judgment, every Muslim until the day of judgment owes Khadija something, because she was the ultimate source of support to the Prophet ﷺ. Now, Khadija passed away, so who was there for the Prophet ﷺ? So there is a need for you to grow from being connecting with the individuals around you to being connecting with the mighty Allah Azza wa Jalla. And this would be done through your like inna jannati fi qalbi, my jannah is in my heart, and there's a jannah in the dunya. If you do not enter it, you'll not be able to enter the jannah of the akhirah. And we look into the resilience of so many people, whether they're Muslim or non-Muslims. You will find that what kept them moving and what kept them going is their own belief in certain ideology. And for us, Allah Azza wa Jal in the Quran tried to build that connection in our hearts, that I am with Allah and Allah is with me, and if I reach that threshold, then alhamdulillah, this is it, I have reached the peak. And that's why in the Quran Allah Azza wa Jal says wasta'inu bis-sabri was-salah wa innaha lakabiratun illa 'ala al-khashi'in. This is in the first subara or juz of the Quran. Allah Azza wa Jal says seek refuge by Allah Azza wa Jal through the patience on salah, and it is too much to handle except for the khashi'in, submissives or mindful. Now, Allah Azza wa Jal also taught us how to be mindful, by the way. How? الَّذِينَ يَظُنُّونَ أَنَّهُمْ مُلَاقُو رَبِّهِمْ وَإِنَّهَا لَكَبِيرَةٌ عَلَى الْخَاشِعِينَ الَّذِينَ يَظُنُّونَ أَنَّهُمْ مُلَاقُو رَبِّهِمْ وَأَنَّهُمْ إِلَيْهِ رَاجِعُونَ. يَظُنُّونَ in the Quran, when it comes, it means certain. وَظَنَّ أَنَّهُ الْفِرَاقُ. He's certain, he's seeing the malaika, the angel of death, but he's still in the dunya. Now, الَّذِينَ يَظُنُّونَ أَنَّهُمْ مُلَاقُو رَبِّهِمْ وَأَنَّهُمْ إِلَيْهِ رَاجِعُونَ. They're going to meet Allah and they're going back to Him. That helps you to establish that state of khushu', mindfulness. And when you're in that state of khushu' and mindfulness, you're superior. You're with Allah Azza wa Jal. Look into how Allah Azza addressed the Sahaba. In the second juz of the Quran, وَاسْتَعِينُوا بِالصَّبْرِ وَالصَّلَاةِ إِنَّ اللَّهَ مَعَ الصَّابِرِينَ. Look into this difference between Bani Israel and the Sahaba. The Bani Israel needed to be reminded about the Akhirah, meeting Allah Azza wa Jal, and the Jannah and the Nar, all the details, to establish that level of spirituality or connectivity. However, the Sahaba have reached that already. Inna Allah ma'a sabrin. Allah is with you. And when Allah is with you, nothing is able to harm you. And when Allah is with you, there is nothing more joyful. And this is what I have been advising my clients, and I have gotten some very positive reward, feedback. Mindful salah. Mindful salah is extremely powerful. I personally had, I shared this, I don't think there is a harm to share it. I used to have stress, as a result of stress, stiffness in my back and my shoulder, and I went to the doctor. The doctor did the X-rays, all of this. So there is nothing they can. There is nothing we can do for you. Take medications, tranquilizers, painkillers. And I said, I don't like painkillers. So I said, well, why not to try mindfulness salah? So I tried mindfulness salah, reading, Quran in mindfulness, in khushu', in contemplation. Subhanallah, amazing results. Amazing results. See, when you stand in salah, and this is what they do, by the way, in quote unquote, yoga, they ask you to stand still or to sit still and look in, on your and look down on your feet position, and that's exactly what we do in our salah. So I said, why not to do the real understanding of salah bi khushu'? And if you do salah in khushu' the same way, trust me, if you're able to engage in salah for 50 minutes or 1 hour, which is not something unusual, by the way, many stories reported to us about the Salihin, the grandchild of Abu Bakr radiallahu anhu, the son of Asma,
Zubair
Abdullah
ibn Zubair.
Yeah, he was like so mindful in his salah. So engaging in salah, that style, standing still, looking down, reflect, contemplate, you disconnect from the surroundings and you connect with the mighty Allah Azza wa Jal, subhanallah, you will see very powerful healing, power comes from inside out. And this should be, I guess, a positive note to conclude and
صحيح.
end our session with, inshallah.
The community has just gone and has just went, and you can still remember the 30 days we spent praying Taraweeh, so they
Yeah,
can't make that excuse that, and I'm sure starting
But see,
rust.
this is the point. It's not just salah. It's not standing behind
Yeah.
the imam. It needs to be reflective salah. It
Yeah.
needs to be mindful salah. Like, you say Bismillah ar-Rahman ar-Rahim. I heard like some people reported to me that Al-Fatiha took them 45 minutes to finish in a salah, in
Yeah.
one rak'ah. There are those, like who did Surah Al-Baqarah in one rak'ah.
Yes.
And we know that, Uthman ibn Affan used to finish, or even Shafi'i used to finish the whole, Quran in one night. So
Yeah.
this is not, impossible, because they were engaged in the Quran mindfully. They were like, they were breathing the Quran. They were living the Quran. They were absorbing the Quran. And Quran have, empowered them from inside out. And that's the real empowerment, to get it from inside out.
Sahih. 100%. By the way, just a quick note, like when people say they recite the whole surah in a short period of time, this is the culmination of many efforts they did before.
Definitely, it doesn't
يعني,
come.
subhanAllah, if it's, you know it, like most people know it. If you know the tafsir of a surah, if you know it, like if you deeply understand it, then even when you recite it quickly, like get that brain activation.
Mindfulness.
Exactly.
أفلا يتدبرون القرآن أم على قلوب أقفالها. Yes.
Jazakumullah khair. May Allah bless you. May Allah reward you for this amazing, very informative, very like eye-opening, and the idea of mental health, like I mentioned in the beginning, it's very much stigmatized. I dare say, especially among the brothers and the older community for different reasons. So hopefully this was insightful and beneficial for many people to shed some light on a topic that many of us are not very familiar with. So may Allah reward you, and may Allah subhanahu wa ta'ala grant us, this resilience through which we can live more virtuous and more healthy lifestyles, both physically and mentally and spiritually.
Ameen bi'idhnillah, inshallah. And thank you also for taking the time after you finished your exams to do this. You and the rest of the brothers and the sisters involved into this, inshallah.
Alhamdulillah, there's nothing I'd rather do.
Alhamdulillah. May Allah give you barakah, ya Rabbi, all of you.
Ameen ya Rabb.
Ameen ya Rabb.
And to the audience, may Allah subhanahu wa ta'ala again, and hopefully you guys are happy with your results.
Inshallah.
And inshallah working towards whatever you have in store next. Like always, this episode you can watch it on YouTube. It's also going to be on Spotify. With that being said, I'll see you guys next episode. سبحانك اللهم بحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. السلام عليكم ورحمة الله وبركاته.